Well, thank you so much for inviting me, Gertrude, for connecting on LinkedIn. And here we are today. I'm excited, but also a bit anxious. So here we go. So my name is Agnes, as introduced. I'm Agnes Nsofwa. I'm in Melbourne, Australia. I'm the founder of Australian Sickle Cell Advocacy, among other things that I do. So when I got connected with Gertrude, I said I would share my story, but I asked myself, like, how and where do I start from? My story is quite long, and I'll try to speak within 15 minutes, I hope. So who am I? I'm a mother of 4 kids, a registered nurse, a data analyst before that, but my job actually now involves data analysts analyzing for the new job. And also being a founder of Australian Sickle Cell Advocacy, I've found myself to advocate for sickle cell disease globally, but also I do present talks on Facebook Live every week, once or twice a week, and just bringing different stories from different communities in the sickle cell space. I also created the Amplify Sickle Cell Voices that I'm very passionate about. We brought over 40 people from 23 countries discussing issues in the community. I also bring professionals, health professionals on Facebook Live to give education sessions. And one of them was Professor Wally Smith, who's a very well-known, experienced profession in sickle cell disease. So before sickle cell advocacy, who was I? I was in Zambia. I migrated to Australia in 2004 with my family. I had no idea the level of severity of how sickle cell disease is. I knew that there was sickle cell disease, but I didn't even know whether it was genetic. I didn't even know what genetics were at the time. And when we came to Australia, I was working in the bank, one of the big 4 banks. I graduated from business school at Edith Cowan University and was just about to go and study a master's of taxation because back home, I was in the tax department. I love tax. I know tax. So I wanted to go and study a master's of taxation before. And then when we came to Australia, we had 2 kids. We had our third child. I stayed home to look after the 3rd child. But again, my 4th pregnancy came. So I decided to stay home for a bit. And when I did, at the time, during pregnancy, I just got sick. So my story is quite long, but I'll try to put the main issues here. So I became very sick during pregnancy with our 4th child from about 5 or 6 months. I was in hospital for, I think, 7 to 8 weeks. Out of those weeks, 2 weeks of those, I was in ICU with an unknown disease. They tested me with all the diseases I could find in the books to find out what was wrong with me. This picture here was one of the worst days that I was hooked up in all sorts of things in ICU. I had to just put this a bit blurry because I don't know who else was going to see my face and my daughter's face. So I was in ICU, and one of the things that the doctors picked up, they asked me whether I had the sickle cell gene. That's the gene that causes a sickle cell disease. Because at the time I had no idea, I said no, and the doctors took my word for it. They didn't test my husband or even told me that your baby might have sickle cell gene itself and come back after she was born. Nothing was discussed, nothing was done. After about 9 months, I was able to give birth. That's how she was a healthy child, a good weight, and she was healthy. And I went home and all the symptoms disappeared. But because I was on a trial and error medication, I had so many complications. I was jaundiced, I developed diabetes, I was put on high steroids, I was very swollen. I had to take about a year to wean off the steroids. My legs were swollen, everything. I couldn't walk. I had HB was about 67%. By the time I was giving birth, it came up to about 87%. But after I gave birth, everything sort of started coming back to normal. But I knew deep down, being a mother of 3 other kids, there was just something different about this child. And I kept telling my mom and my mother-in-law who came to visit at the time, I just said, there's just something wrong, but I couldn't pinpoint what it was. And so when she started growing up, we started noticing a few issues here and there, which at the time we didn't actually know they were actually sickle cell symptoms. At 6 months, she had one of the first symptoms for kids who have sickle cell disease, having the swollen hands and feet. And every time I would have a chance to see the doctors, I would explain to the doctors the story of my life, how I was sick at the time. When I was pregnant with her, they should do a full body check on her, but they didn't. At 7 months and 9 months, she had pneumonia infections, which was cured in inverted commas with antibiotics. Also at 9 months, she had what they call brief and resolved and explained event in medical terms. This is where a child just sort of loses consciousness for maybe a bit, maybe about 1 or 2 minutes. So when I researched this, when I went to uni, and other parents that have sickle cell kids, this is some of the things that they go through. And then at 14 months, 2 months after having a 12 months injection, she had another attack of pneumonia, but this time it never went away. It became what they call an acute chest syndrome. That's a very severe pneumonia attacking the lungs. One lung was collapsed and they had to drain the fluid. So this was the tank here taking the pus out of our lungs. And we spent about 6 weeks in hospital. That's when we were told that she had sickle cell disease. And I refused. I was just like, there's no way, because they gave me a diagnosis, mind you, at pregnancy, which they said was Still's disease, something to do with arthritis of the blood or something like that. So I told them that, no, you got it wrong. I think she has what I had when I was pregnant. Go and retest, because we don't have sickle cell in our family. But we were wrong. We had to be convinced to be told that she actually had sickle cell disease. And so coping as a family after the experience, it was a very difficult time, because I always say we considered ourselves even from both parents as a healthy family, because none of us had been in hospital. Every time that I gave birth to my kids, I would go, I think my first 2 kids, I was at work at 5 p.m. at night. I went to hospital, gave birth, came back home. That was our life. And we didn't share with most of our friends, our family for a few years. Life changed forever. We became a family of going to hospital in and out every 2 weeks. We had to have a bag nearby in case she gets sick. But we also tried to, have a balance. And it took about 5 years for us to open up to other friends and families to actually tell them what we were going through. And so at the time I asked myself, so when I wanted to present this presentation, I was telling myself, how am I going to put this across? So I looked at the 5 stages of grief and loss. And I got an article from Linda Paston, these are the things that we actually went through. Anger, denial, anger. We started bargaining, those depressive episodes, especially for me. And then finally accepting. And one of the things that I did by accepting was to go to nursing school, which I'll talk about a little bit. So during the denial period, this is where I just said, no, there's no way. I asked the doctors to retest. I said maybe it was a misdiagnosis. I kept reading. And in the hospital, actually, when my mother-in-law was there, I told her that I hate relying on Dr. Google. I have to go and study medicine. I was very serious. I even started researching how to go into medicine school in Australia. I wanted to sit the GAMSAT exam. I was very sure that I was going to go into medicine. And at this period, it was the toughest, because in my head, I said, there's no way my daughter had a chronic condition. And then became the anger. I became an angry person. I needed someone to blame. And one of the beings that I blamed was God, first of all. I started talking to God, why me? Why my family? I became angry with the doctors who misdiagnosed. They didn't tell me when I was pregnant that there was potential that my daughter might have sickle cell disease. And different hospitals, because I was at one hospital where they missed 3 times. They sent me when she had the pneumonia, 12 months, they sent me back. I became angry with them. All doctors, I actually went through a process of suing some of the doctors. I also became angry with our parents that they should have told us that, because down the line we found out that they knew actually that there was sickle cell in the family. So that was another stage that took time for me to release that anger. And then came the bargaining period. This also, I know, it took a bit of time, about I think 2 years, where I started looking at the bright side sometimes. Not all days were bad, but this picture up here, she was still had sickle cell disease. We went to places where the hospitals would take us as families. This was taken in Canberra. Not all days were bad, but most days were unknown because she would get sick anytime and we had to carry that bag and rush to the hospital. And then the depressive episodes came. This time, I've got a husband who works away. He works away in the mines. So I became a single mother half of the year. I was alone and I had to work part-time. Nothing made sense, but I had to be strong for my kids who relied on me. I had to be strong because I needed to work. And most times people didn't know that I was battling all this because I'm a person who loves smiling. I'll be smiling at work, but I'll be crying in my bedroom because there was just that period where, and at one point, my husband encouraged me to go and see a psychologist, which I did. But the first thing they did, I think the second session, they wanted to put me on antidepressants. I'm one who's not very compliant with medication, so I turned down. I said I might try to do other things to cope, and somehow I managed by speaking to people. So those depressive states sort of went away, or sort of help even now when I'm in that stage, when I started speaking. So I started talking, and one of the things I decided was to go back to uni. 3 years after her diagnosis, I went to university, and this time we moved from Western Australia, where she was born, went to Sydney, and I went to nursing school because I just realized the reality hit me that I had four children, one with a chronic condition. There was no way I was going to manage to go into med school. So I told myself that at least I can go into nursing. Instead of doing an EN course for 18 months, I decided to do a master's degree in nursing, 2 years at University of Sydney. And that was 5 years after her diagnosis. Then I started accepting slowly because I understood the hospital system. I could read the numbers. I understood what sickle cell disease was. And I was confident to tell other people about what our family was going through. And so the road to advocacy started. How this started was for me to cope with my depression. I started talking to people, anyone that could have an ear, especially if they come from an African background. I'll tell them about sickle cell disease. I started with opening a Facebook page, and this became about because most of the things that I saw on other Facebook groups were quite depressing for me. And I wanted to take control by researching articles every day, good stories that I wanted to research so that I could post on Facebook. And I decided to do that with a Facebook page. And I started raising awareness in the hospitals with the pediatric hematologist. My daughter's hematologist, every awareness day would put a table at the hospitals. The followers on Facebook grew, and we decided to open a not-for-profit organization with no experience at all, with a lot of mistakes even now that we are making. We've decided that we will continue doing what we do. And this was our launch. We planned to have 50 people for the launch. We ended up having 140 people that came to our official launch in 2019. My daughter is now cured. We chased the cure from Western Australia to Perth to Melbourne. And it all started in my living room when I was watching TV, and I saw this doctor on TV who was discussing curing a boy who had a blood disorder through a bone marrow transplant. I contacted that doctor, and she assured me that there was light at the end of the tunnel because we had a sibling donor. We packed our bags again, and we came to Melbourne on the 21st of February. After a long story, to cut the long story short, she had a bone marrow transplant through sister being a donor. And that same doctor cured my daughter. We were her last patient before she moved back to France. And today she's 759 days post bone marrow transplant. A bit about Australian Sickle Cell Advocacy. It's a not-for-profit organization supporting people affected by sickle cell disease in Australia. We're in Melbourne, but now we've grown to 5 other states all across Australia. Our mission and values, we are a leading advocacy supporting organization for people affected by sickle cell disease in Australia. We do this observing our values, which are empathy, perseverance, because you can't persevere with this kind of job because it's been very difficult and challenging for us. Integrity and caring for all. Our objectives really at this point is just to raise awareness because we're quite a young organization and the condition is considered a rare disease in Australia. We're supporting people through support groups and advocating for different options, which is medication, scientific research, and other things that are missing in this community of patients. And we are doing this, obviously, we're facing a lot of challenges, but we never give up because of our values. And so where to from here? I found myself during the pandemic that I didn't actually plan it, but I've found myself to advocate for people globally. And this is using our Facebook platform. So I've got people that contact me or I contact people from anywhere in the world who want to discuss issues in sickle cell, their stories. I'm also an advisor on one of the American organizations, sickle cell organizations. I've also spearheaded the formation of an African sickle cell organization through the talks that we started, the Amplify Sickle Cell Voices. So those 23 countries became together and we formed an alliance. I'm also a steering committee on an Australian patient group organization. I've got involved in my countries, my home country is Zambia. So I'm part of the group there trying to also advocate and raise awareness in that country. I was part of the group that we managed to do the guidelines for that country. I've continued to reach out to many people that are impacted by sickle cell disease without knowing. And hopefully this year or next year, I'll start a PhD with a focus on any topic, mostly on sickle cell disease. So, and why do we do this, especially in Australia? Migration has taught us that we've got a lot of people that might be impacted by sickle cell trait. We have over 700,000 people that migrated to Australia from these countries with this color apart from green, from 1996 to 2018. And so there's potential that we have some people that have got the sickle cell trait and they should know, because I lived 30 years without knowing that I had the sickle cell trait until my daughter was born. And finally, I would like to invite you to our first ever conference in Australia for sickle cell, which is scheduled on the 17th and 18th September 2021. Thank you so much. That's all I had to share. I hope I did go over time. I had to put my story just a bit short because it's too long. Thank you.